And now, please welcome Atlantic staff writer Ed Yong.
In June 2020, when I first started reporting on long COVID, few scientists or physicians knew that it existed, and many doubted that it did. The common wisdom was that people infected with SARS-CoV-2 mostly get mild symptoms that resolve after 2 weeks. And yet, thousands of long haulers had already been debilitated by months of extreme fatigue, brain fog, breathing difficulties, and other relentless rolling problems. Some of the long haulers I interviewed last May have recovered. Others, including many who were young and were formerly healthy and athletic, are on day 500 plus of symptoms and are still experiencing weekly crashes. Things have progressed a little. Long haulers defined, described and drew attention to long COVID all while sick. Thanks to their own efforts, the biomedical community has begun to take notice. Several clinics now care for long COVID. There's more acknowledgement that long COVID is a real problem. But that acknowledgement is not universal. Many long haulers are still being wrongly dismissed by doctors who tell them that their intense physiological symptoms are simply psychological. Many are struggling to claim disability benefits, and due to their many debilitating symptoms, they have lost their jobs, their income, their homes, and even their lives. Long haulers are also deeply frustrated at the slow and flailing response from the biomedical community. The NIH has received nearly $1.2 billion from Congress for long COVID research, but those studies haven't even begun to recruit patients. Meanwhile, long haulers researched their own condition well before academia was even aware they existed, and now they understand long COVID better than anyone. But they've watched many researchers ignore their needs and their expertise and run flawed, inefficient studies as a result. They've seen academics contort questions about long COVID to fit pre-existing research agendas instead of doing work that most quickly addresses the needs of patients. They've watched researchers reinvent the wheel and rediscover basic things about long COVID that they already knew. They're feeling excluded from their own narrative. The message seems to be, thanks for everything, academia can take it from here. Many academics are also wrongly treating long COVID as a totally new thing and ignoring the huge overlaps with other complex, chronic, marginalized illnesses such as myalgic encephalomyelitis, also known as chronic fatigue syndrome. This is slowing the pace of research and shepherding long haulers into dangerous treatments. For example, many long haulers have the hallmark symptom of ME, that's post-exertional malaise, where even mild activity can lead to severe crashes. For those people, exercise, which many long haulers are told to do, can make things permanently worse. Long haulers, people with ME/CFS, and others with chronic illnesses don't have time for science to do its incremental stumble, for dogma about disease to gradually shift, for academia's gatekeeping mechanisms to slowly buckle. They need a transformative, patient-centered approach to research. They need science that acts in service of solving urgent problems instead of padding the publication records of researchers. They need social support. They need everyone to stop thinking of the pandemic solely in terms of two extremes, good health or hospitalization and death, while ignoring the vast hinterland of disability that lies between and in which millions are trapped. Long COVID remains one of the pandemic's biggest and least addressed unknowns. And the choices we make about how to study this condition will define the toll that SARS-CoV-2 takes for years to come.